questions. Questions orales. The honourable member from Regina Capel.
When will the Prime Minister make it illegal to smoke crack in a hospital room? Just the date, please.
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, the province of BC made a request for a temporary pilot project. BC now has concerns about that project, which we share. We are now working together to address those concerns. Opioid addiction is a tragedy that has affected far too many Canadian families. We have to work together to solve it, not score cheap partisan points off the pain of Canadians. There are no pilot projects anywhere else in Canada.
The honourable member from Regina Capel.
Because of this government's decision, it is no longer illegal to smoke crack, meth, or shoot up heroin in public spaces in British Columbia like parks, hospitals, and public transit. The British Columbia government has now begged the Prime Minister to reverse this decision. So, simple question, when will the Prime Minister once again make it illegal to smoke crack in a hospital room? Just the date.
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, unlike the Conservatives, we believe in working together with Canadians to solve our country's most pressing problems. That's why earlier this week I was in touch with Premier Eby, and I assured him that we share his concerns and we are working urgently together to address them. And let's remember, opioid addiction is a tragedy which is afflicting so many Canadian families. Let's work together to help them not score cheap partisan points.
The honourable member from Regina Capel.
Dangerous addictions are hurting Canadians. After this government's decision to change the law, overdose deaths shot up and drug-related crime went through the roof. Now, the British Columbia government is asking for the government to reverse their decision. It's a simple question. It's a simple decision to make. So one final time, Mr. Speaker. On what date will this government make it illegal to smoke crack in a hospital room? Just the date.
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, unlike the Conservative House Leader, I've actually been in touch with the Premier of BC about this truly pressing issue. And unlike the Conservatives, we are working collaboratively with the province of BC. We share their concerns, and we are working together to support public health and public safety. What we're not doing is fundraising off of the pain, death, and suffering of Canadians.
The honourable member for Mégantic-L'Érable. Every day that this radical Prime Minister dithers on the deadly experiment of legalising hard drugs is another day that people die. Currently 6 a day in British Columbia. After 9 years of this Prime Minister, Quebec is not immune to this crisis, which affects every part of Canada. I quote from the Journal de Montréal, "Crack use is exploding in Montreal and we'll be seeing more and more of it in public places." Will the Prime Minister put an end to his extremist experiment in legalising hard drugs and say no to any expansion in Quebec? The Honourable Deputy Prime Minister and Minister for Finance. Mr. Speaker, British Columbia has asked for a pilot project. British Columbia now has certain serious concerns that we share. And that is the reason for which we will be working urgently in close collaboration with the province to meet these concerns. Mr. Speaker, these are tragedies for families throughout Canada. We need to put partisanship aside when it comes to this kind of matter. The honourable member from Mégantic-L'Érable. It's not partisanship to talk about syringes on the floor, degrading scenes, and outbursts a stone's throw from a school in Montreal. Now that we know that the radical experiment in legalizing hard drugs in British Columbia by the Prime Minister, supported by the Bloc Québécois, by the way, was catastrophic and deadly. The Bloquiste MP for Joliette said in this House, the hope is that this pilot project will pave the way. The MP for Rimouski said, we in the Bloc Québécois are deeply convinced that this is a step in the right direction. Quebec doesn't want this. Can the Prime Minister assure this House that he will not follow the radical advice of the Bloc Québécois? The Honourable Deputy Prime Minister and Minister for Finance. Mr. Speaker, the opioid epidemic and addiction is a tragedy that we have to fight together by giving a priority to the health and safety of Canadians. But, Mr. Speaker, Conservatives are just saying that our policy is extremist and radical. Do you know, Mr. Speaker, what is extremist and radical? White supremacy policy. Misogyny is radical. And so it's time for the Conservatives to denounce those policies that are truly extremist and radical.